Hi everyone, my name is Trang Nguyen. My pronouns are they, them, and I welcome you all to this 15-minute version of my mini workshop on gender and sexual identity and expression, understanding and supporting mental health needs. I want to send gratitude to you all for being here and taking time out of your busy schedule to learn more about this topic. I'd like to add that this is an incredible honor to present on this topic during Pride Month. Before getting into the nitty-gritty of this workshop, let's take a moment to check in with ourselves. Using these two emotions chart, how are you arriving in this moment? Pause the video here and take a moment to jot a few things down or just name them in your head. Thank you for taking a moment to check in with yourself. As you transition from your busy morning, let's practice grounding together so you can be as present as possible in the next 14 minutes. We'll take a collective breath to reset and ground in the present moment and give yourself permission to transition into this space. Go ahead and breathe in through your nose and breathe out through your mouth. Thank you for taking this time to ground with me. I will briefly introduce myself so you know who I am and how I have arrived here. I am a decolonial psychotherapist, abolitionist social worker, licensed clinical social worker, and a community organizer residing on the unceded land of the Ohlone people, colonially known as Oakland, California. I arrive here as descendant of colonized, occupied, displaced, and liberated Vietnamese people. My lived experiences of being a queer, non-binary, neurodiverse, disabled person of the global majority, navigating the world and the trauma that comes with that, has led me to the practice of healing. As I learned about intersectional oppression, I began to make sense of myself, the world, and how everything is interconnected. My values for collective liberation, healing, and community have led me here. And on the right side, you can see my areas of practice. For today's agenda, I will go over understanding gender and sexual identity for personal and collective expression, supporting mental health needs through the lens of gender and sexual identity for personal and collective expression. We will identify the call to action, and then we will close out. So let's go over accessibility and setting the stage for today's lesson. Throughout this video, make sure to tend to your needs. I encourage folks to check in with yourself throughout the workshop and tend to your needs however that looks like. At any point, go ahead and pause the video to meet your own needs, however that shows up for you. No experts, no hierarchy. This is a collaborative learning space, meaning that although I am the facilitator, I am not the expert in the room. This is an interactive way of learning that involves practice, self-reflection, going inwards, applying your own experiences, and building out many complex perspectives. Learner's mind. Although some of you may already know about gender and sexual identity, I invite you to approach this container with a learner's mind. Go inwards. If you notice intense emotions come up during our time together, take note of it, notice it without any judgment, and be curious about it. This workshop is meant to call you in, to mobilize you, and propel you to take action and create change within yourself and your community. And my hope for you today is that you will walk away with a better understanding of gender and sexual identity to help better understand and support mental health needs for yourself, community, colleagues, and patients. I invite you to collectively move through the steps of centering gender and sexual identity to ensure that we do not create unnecessary harm and build towards a sustainable society for all. So let's start from the very beginning. What are the differences between sex, gender, and sexuality? Sex, also known as biological sex, is assigned at birth as female or male by doctors based on genitalia at infancy. Gender is a social construct which attaches cultural meaning to being masculine, feminine, something in between, or no gender at all, which also influences your personal identity and how you view yourself. Sexuality is sexual attraction and practices and identity, which may or may not align with your sex or gender. To go a little bit deeper, you can pause and read more about gender and sexual identity here. What is the difference between gender identity versus sexual identity? These are distinct. Gender identity is a person's inner sense of being male, female, or somewhere else along the gender spectrum. Sexual identity is about who you are attracted to. So let's get into it. Queer, transgender, gay folks on the full spectrum have always existed throughout human existence. The blatant ignorance in today's society dehumanizes queer folks and is a systemic construct that is meant to oppress, suppress, and separate us as full human beings. As we go through the definitions of gender and sexual identity and expression, try to absorb the information through the lens of your personal relationship to your gender and sexual identity, and through the lens of being in community with your friends, family, colleagues, and patients. Here's a chart I made to help differentiate between gender identity and expression and sexual identity and expression. Pause here to read through this chart at your pace. Here are the key concepts in terms of gender identity and expression. You can pause here to read through the slide at your pace. People use a wide variety of terms to describe their sexual identity. You can pause here as well to read through this slide at your pace. Here's another infographic to better explain gender identity, sexual orientation, gender expression, and biological sex. It is entirely normal for attractions and the language someone uses to describe themselves to evolve or shift over time. An important term to remember during this workshop is heteronormative, pertaining to the practices and institutions that legitimize and uphold privilege to heterosexuality, heterosexual relationships, and traditional gender roles as fundamental and natural within society. The foundation of supporting mental health needs is collective liberation, which links individual well-being to dismantling structural oppression. Identity exploration becomes both personal healing and a solidarity act that transforms systems affecting everyone. Why is this important to explore gender and sexual identity and expression through a collective liberation lens for self-exploration, community care, and professional care? Let's start with self-exploration, relational healing, mental health maintenance, shared resilience, agency and responsibility. Supporting mental health needs on a community level includes mutual aid over charity, belonging and support, inclusive safety, stigma reduction, organizing power. Supporting mental health needs on a professional level includes accurate assessment and treatment, culturally attuned care, safety and harm reduction, ethical practice, ethical solidarity, trauma-informed, justice-oriented care, and power rebalancing. Here are practical steps to support mental health needs. Use inclusive, non-heteronormative language and correct pronouns when referring to yourself and others. Consistently identify and acknowledge your own personal biases, stigmas, internalizations of heteronormativity, gender, and sexuality to prevent projecting it onto your community, colleagues, and patients. Failing to center gender and sexual identity and expression harms individual well-being and undermines community resilience, degrades workplace safety, worsens patient outcomes, and perpetuates systemic inequities, and exposes organizations to ethical and legal risk. Prioritizing these needs is essential for effective, safe, and equitable care. I invite you to this call of action to center gender and sexual identity and expression when supporting mental health for personal and collective care. Take one concrete step today and commit to these daily practices. Use and correct names and pronouns. Educate yourself with credible resources. Practice visible solidarity. Invest time and resources. Create accessible, safe, and inclusive spaces. Normalize conversations. Train your staff. And accountability. There are so many reasons why a call to action is important. One of the many reasons is because transgender and gender expansive individuals experience disproportionately high rates of fatal violence and victimization compared to cisgender individuals. While exact per capita murder rates are difficult to calculate due to underreporting and inconsistent demographic data in official records, documented trends highlight severe risks, particularly for transgender women of color. Trans women of color, Black and brown trans women face the most severe rates of violence. They consistently account for the vast majority, approximately 88% to 90% of documented fatal violence against fatal violence cases globally and in the US. Perpetrators, a notable portion of fatalities occur at the hands of intimate partners, family members, or acquaintances, while many others are targeted by strangers in street-level violence. Mainstream gender and sexual identity education reduces fatal violence against transgender and gender expansive individuals by changing the societal prejudice and social norms that fuel hate and discrimination. By teaching diverse identities, school and public programs lower bias-based bullying, increase empathy, and help individuals recognize transgender and queer people's basic humanity. People are not born with biases. They learn them through social norms. Educational interventions such as interpersonal contact and empathy building have been shown in research to rapidly reduce transphobic beliefs among cisgender individuals. Here are a few reflection questions that you can reflect on and answer to yourself. As I read through the reflection questions, I invite you to stretch and move your body to get the juices flowing. Have you had to hide any parts of your gender and sexual identity and expression due to social stigma? How has your gender and sexual identity and expression evolved throughout your life? If you were able to freely evolve as a human being without heteronormative or gender expectations, who would you be? You can pause the video here to jot down a few things or just name them in your head. Before we officially close out, I want to leave you with this. Viewing gender and sexual identity exploration through collective liberation reframes care as interconnected. Personal healing, community solidarity, and transformation work contributes to harm reduction, expands autonomy, and creates sustainable health equity for all. Centering gender and sexual identity and expression is not optional. It's essential to prevent harm, promote mental health, community well-being, and achieve collective liberation. Thank you.